Therapy with a therapy assistant. A therapy assistant, also called an allied health assistant, is a healthcare professional who provides support to participants and families in a variety of settings, such as hospitals, clinics, or community health centres. Therapy assistants typically have a certificate, a 3 or 4, from a registered training organisation. They might also be a student, such as a speech pathology student or an occupational therapy student. Therapy assistants help your child make progress with their communication, daily living, and social skills. The role of a therapy assistant is to provide support to participants and families. This may include providing scheduled appointments, providing emotional support, and practicing therapy. They may also play an important role in participant education and planning. Therapy assistants are an important part of the healthcare team. They play a vital role in supporting participants and families during their time of need. A child therapy assistant helps children with developmental disabilities and chronic health conditions. They work with other allied health professionals such as occupational therapists and speech pathologists to provide care for participants. Child therapy assistants typically have a degree, a certificate degree, in a field such as disability or child development or psychology. The duties of a therapy assistant vary depending on the needs of their participants. They may help with activities of daily living, such as bathing or dressing. They may assist with therapeutic exercises that are prescribed by a therapist as well. Therapy assistants are not a replacement for your child's therapist, but they are an important part of the team who work together to support your child. The therapist will continue to provide the clinical therapy, and the therapy assistant will support the implementation of therapy programs and other aspects of care. The role of a therapy assistant can vary depending on the needs of the individual child and their family. They may be involved in providing therapy services, supporting families with home exercise programs, or helping to implement behaviour management strategies. The NDIS does cover therapy assistance. This means that if you have an assistant who helps you with your daily living activities, they can be funded through the NDIS. The amount of funding you receive will depend on your child's individual needs and circumstances. If you need help finding a therapy assistant, the NDIS can assist you with this. They can provide you with a list of registered providers who offer that service. You can then contact these providers, such as SLCN, to discuss your needs and see if they are able to help you. A therapy assistant works under the direct supervision of allied health professionals and performs tasks that do not require formal registration, such as administrative tasks, clinical tasks, and patient education. Important factors for participation in therapy assistant services including the frequency, using the specific practice that's been set out by the therapist, feedback loops between the therapist, the family, and the therapy assistant, the child being motivated to practice and interact with the therapy assistant being able to attend appointments and use the therapy materials that have been provided. So today we just had a quick look at what a therapy assistant, the role that they play, and what sorts of therapy they can assist with.